Good morning, and thank you all for joining us here at the State Health Center in Lancaster County. I'm Pennsylvania's Secretary of Health, Dr. Deborah Bogan, and I'd like to thank our area healthcare partners who are here with us today from Penn Medicine, Penn State Health, and WellSpan. They are integral partners in fighting this measles outbreak. I'd also like to recognize our partners at UPMC, who unfortunately can't be here with us today, but are also helping to stop the spread of the measles virus. We are all here today to update you on our ongoing proactive response to recent measles cases in the region and how the public can help. I also want to thank Rep. Nikki Rivera, who is here with us today. We deeply appreciate her support for being here and for this response. I want to be very clear on a few things. First, the Department of Health is working closely with healthcare providers and community partners to prevent the spread of measles and provide easy access to vaccinations. The overall risk to Pennsylvania residents remains low because of high vaccination rates across the Commonwealth. People who have been vaccinated or were born before 1957 or have had the measles in the past are protected. And nearly 94% of Pennsylvania kindergarten students are fully vaccinated against measles. Getting vaccinated is the best way to protect you and your family against measles. 2 doses of the measles vaccine provide 97% protection from measles infection. And keep in mind that the vaccine has proven its effectiveness for nearly a half a century. Since the vaccine was introduced in the 1960s, cases and deaths from measles have decreased more than 97% from the pre-vaccine era. That was really loud. So again, cases and deaths from measles have decreased more than 97% compared to pre-vaccine era. The department and our partners are working to ensure that people who want accurate information about measles and access to measles vaccine have them. That is why we are here today, and we appreciate you all being here to spread and share that word. As a pediatrician and as a Secretary of Health, my highest priority is the health and well-being of every single person in the Commonwealth. That said, what is measles and why is protecting yourself from the virus so important? Measles is a highly contagious, serious respiratory virus that can lead to severe illness. It typically starts with a fever, runny nose, and watery eyes, followed a couple days later by a rash that starts on the face and spreads down the body. And some people may suffer severe complications, such as pneumonia, which is an infection of the lungs, or even swelling of the brain. Among the more than 2,000 people in the United States who had measles last year in 2025, 11% were hospitalized, demonstrating its potential severity. Let me tell you now about the status of measles here in Pennsylvania this year. As of Thursday, June 25th, that's yesterday, this year the Department of Health has confirmed 83 people with measles statewide. The majority of those cases are part of an ongoing outbreak here in the Lebanon-Lancaster region. 71 individuals have been diagnosed with measles during this outbreak, which started in late April. Here's the county breakdown. 40 individuals confirmed here in Lancaster County, 20 in Lebanon County, 6 in Northumberland County, 2 each in Berks and Dauphin counties, and 1 in York County. These are people, they're not numbers. These are people, these are not numbers. They are children, parents, neighbors, and friends. And unfortunately, there is only supportive treatment when you get measles. There's no fast cure. And among children under age 5 who get measles, about 1 in 5 or 1 in 6 get sick enough to require hospitalization. And the best way to protect people in Pennsylvania's youngest residents and most vulnerable is to create community immunity by getting vaccinated. High rates of vaccination in a community help to reduce the spread of this highly contagious measles virus. Building stronger immunity to this virus strengthens the overall health of our communities. These numbers show us the impact of the virus, but they don't show us the hard work being done behind the scenes by the Department of Health and our many local partners. We're not sitting back and just watching the virus spread. We have launched a robust, proactive response because measles, as I've said, is very contagious and can spread quickly among people who are not immune. In fact, if an unvaccinated person is in a room with someone who has measles, there is a 90% chance that they too will get the measles. So our response is based on building a strong network of partnerships. As you can see here today with us, the Department of Health is working hand in hand with local healthcare providers and trusted community organizations to ensure people across the state have access to accurate information and to vaccines close to home. We're meeting people where they are, answering their questions honestly, and breaking down barriers to care. This targeted effort is already yielding results. Right here in Lancaster-Lebanon region, the Department of Health staff and community partners vaccinated more than 430 residents in the past 2 months at pop-up clinics, large and small. At the state level, our 59 state health centers have administered more than 1,300 doses of the measles, mumps, and rubella, or MMR vaccine, thus far this year. But our response goes beyond getting people vaccinated. As you may remember, measles was essentially eliminated in the United States decades ago. So the reality is that most healthcare providers practicing today have never actually seen a case or treated a person with measles during their career. And I can attest to that personally. In my 30 years as a pediatrician, I saw only one patient diagnosed with measles. And so to ensure that healthcare providers are fully equipped with the critical information they need to identify and treat people with measles, the department hosted 3 virtual webinars that were attended by more than 500 healthcare providers across Pennsylvania. We've also shared that information with more than 500 additional healthcare providers and public health professionals at the Pennsylvania. Those trucks make it hard. We've shared it with more than 500 additional folks at the Pennsylvania Immunization Conference that was held just last week. We are training providers on symptom identification, testing, proper isolation, treatment, and prevention. So if someone walks into a clinic or an emergency department in the Commonwealth, your healthcare team will be prepared. As we continue to combat the measles virus, I want to leave Pennsylvanians with 2 vital truths. First, the measles, mumps, and rubella, or MMR vaccine, is the best way to protect you, your family, and our communities. 2 doses of the MMR vaccine provides 97% lifelong protection against measles. When you get vaccinated, you are not just protecting yourself. You are building a shield around those who cannot get vaccinated. Infants who are too young, pregnant women, and neighbors undergoing cancer, chemotherapy, or treatments, or having an organ transplant. Getting vaccinated is truly an act of profound care for your family and your community. Second, I want to assure you that the Pennsylvania Department of Health is working hard to limit the spread of the virus. Our epidemiologists, our community health nurses, and our local partners are working diligently to get measles under control. We have a robust, proven contact tracing system in place, and we will not slow down until this outbreak is over. To the residents of Lancaster, Lebanon counties, and all of Pennsylvania, I encourage you to get vaccinated and protected against measles. If you have questions about measles or the vaccine, I encourage you to talk to your healthcare provider or call or come in to one of our state health centers, like the one right here where we are today in Lancaster. You can find your closest state health center by visiting health.pa.gov/SHC for State Health Center. You can find more information about measles at pa.gov/measles. We are here to help you without judgment because your health is our mission. Now I'd like to introduce Dr. Jeffrey Martin, who's chair of the Department of Family and Community Medicine at Lancaster General Hospital, one of our great partners helping respond to the current measles outbreak in this area. Dr. Martin, thank you.
Good morning. I've had the privilege of living in and practicing family medicine in Lancaster County for more than 30 years. During that time, I've cared for countless patients and families, but there is one disease that I've never seen in my clinical practice, which is measles. In fact, the last time I encountered measles was as a medical student in Colorado more than 3 decades ago. I still remember that patient, a child with a high fever, red eyes, and the classic rash we learned about in textbooks. At the time, it was an illness we were trained to recognize because it still appeared occasionally in clinical settings. None of us imagined that one day measles would become so rare that, as Dr. Bogan mentioned, most physicians would go their entire careers without ever seeing a case. That's where we are today. Measles is exceedingly rare in the United States, except in local communities where it can gain a foothold. That is a remarkable public health achievement, driven largely by vaccination. But that success also creates a new challenge. When a disease becomes this uncommon, it becomes harder to recognize. Many early symptoms of measles, fever, cough, runny nose, look like just common viral illnesses. And for many clinicians, including myself, measles is not something we've had to diagnose in real time. So when you combine that unfamiliarity with a virus that is highly contagious, it underscores the importance of being especially thoughtful about how we identify and respond to possible cases. So this brings me to one of the most important practical messages that we can share. If you think you or your child might have measles, or if you have been exposed to someone with measles and experiencing symptoms, please call ahead before seeking care. Calling your doctor's office, urgent care, or emergency department in advance allows healthcare teams like ours to prepare, to arrange safe evaluation, minimize exposure to others, and protect vulnerable patients who may be in waiting areas. This simple step can significantly reduce the risk of spread. I also want to take a moment to talk about something remarkable that I have seen repeatedly in Lancaster County. It is a defining characteristic of our community to help others, especially the most vulnerable during times of crisis. I have witnessed countless times neighbors helping each other recover from prior disease outbreaks, house fires, and weather events. We reach out to those who are hurting or new to our community and provide welcoming encouragement. It is, in my opinion, what makes Lancaster County unique. Vulnerable members of our community rely on all of us. When vaccination rates are high, the virus has very little opportunity to spread. When gaps emerge, even small ones, measles can find a way back in because it is so contagious. So while measles may feel like a disease of the past, it remains a very real threat when given the opportunity. The tools we have, awareness, thoughtful care seeking, and vaccination, are what allow us to keep it rare. And ultimately, what keeps measles rare is not luck. It's the choices we make together to protect those who cannot protect themselves. Thank you. It's my pleasure now to introduce Dr. Eugene Curley, who's the Medical Director of Infectious Disease Medicine at WellSpan Health.
Good morning, everyone. I'd like to first start off by thanking the Pennsylvania Department of Health and Secretary Bogan for bringing us together on such an important public health issue. And at the risk of sounding like a broken record, I want to reiterate some of the points you've already heard today. So as measles continues to spread throughout our region, it's critical that people understand what to look for because early recognition can prevent further transmission and protect vulnerable individuals in our communities. Measles is a highly contagious viral illness that often starts with what can feel like a common cold. Typically, the symptoms seem to appear 1 to 2 weeks after exposure. The earliest signs include a high fever, cough, runny nose, and red and watery eyes. These symptoms can easily be mistaken for a cold or a flu, which is why awareness is so important. Within a few days, some patients develop small white spots inside their mouth, and this is a hallmark sign of measles. Shortly after that, the most recognizable symptom appears, a red rash, which typically begins on the head and face and works its way downwards to the rest of the body. As the rash develops, fever can spike even higher, sometimes above 104 degrees Fahrenheit. It is important to remember that individuals are contagious even before the rash appears, which is one of the reasons why measles can spread so quickly. While many people recover from measles, it is not a harmless illness. It can lead to serious complications, especially in young children, older adults, pregnant women, and those with weakened immune systems. Some of those complications may include bacterial pneumonia or a potential fatal brain infection called encephalitis. At WellSpan Health, we are actively monitoring the situation, working closely with our public health partners, and ensuring our care team members are prepared to identify and respond to suspected cases quickly and safely. We also want to remind our community that care is available. If you believe you or your child may have been exposed to measles or are experiencing symptoms, we encourage you to contact a healthcare professional before coming in, so we can guide you on the safest next steps and help limit potential exposures to others. Finally, prevention remains key. Staying up to date with recommended vaccinations is the most effective way to protect yourself, your family, and your community. This is a moment for all of us to stay informed, stay vigilant, and work together. At WellSpan, we remain committed to providing safe, high-quality care and to supporting the health of every community we serve. Thank you, and I'd like to introduce Dr. Famida McGann from Penn State Health.
Thank you, everyone, and thank you for coming. So we are unfortunately witnessing an outbreak of an opportunistic and preventable infection. I say opportunistic because this measles virus exactly looks for people who are vulnerable amongst us who are unvaccinated or cannot be vaccinated. As a physician and a mother with young children who are fully vaccinated, vaccinated and immunized, I strongly urge anyone who is eligible to get the vaccine, who may not know their status or have not previously been vaccinated, to do so immediately. At Penn State Lancaster Medical Center, we've had patients with measles who required hospitalization for several days due to serious electrolyte abnormalities, kidney and liver dysfunction, as well as blood count abnormalities, which left them exposed to serious organ failure, secondary infections, as well as bleeding. And these consequences are especially more severe and more likely in the vulnerable populations, as we've all kind of heard about. Vaccination not only protects your family, but also the newborns, individuals undergoing treatment for cancer, organ failure, or autoimmune diseases like lupus, sarcoidosis, rheumatoid arthritis. I recently advised a family member against traveling to this area with her preemie newborn who just got home from the NICU. The first dose is typically administered after 12 months, but in outbreak situations, we do recommend starting as early as 6 months of age. As you've heard, the MMR vaccine is highly effective. For those who are unable to get vaccinated, please consult your doctor to come up with a suitable plan for what to do if you've been exposed. The internet offers a wealth of information, but it's crucial that you rely on your trusted sources, including your local health department or the American Academy of Pediatrics. If you have any questions or concerns about the vaccine, please seek guidance from your healthcare provider. The old saying, an ounce of prevention is worth a pound of cure, still holds true today. Thank you.
Well, thank you so much for all of you for being here and sharing your wisdom, your experiences. And we're happy to take some questions. And Neil Ruland here will help organize that question and answer.
Press Secretary, Department of Health. Hannah, go first.
Dr. Bogan, you said that around 94% of kindergartners across statewide are vaccinated against MMR, but we've identified pockets that are much lower than herd immunity, some around 30%. So what is the health department doing to reach those communities and those who might be reading that vaccines don't work or are vaccine hesitant?
Thank you so much. First of all, I want to say that, for years, the Department of Health has put out information about vaccines in schools, vaccine rates in schools by county and by state. Before the start of the school year, we will be publishing the annual vaccine immunization status by school. So stay tuned for that and monitor our website. We're working very closely with the Department of Education to ensure that we get information to all the schools, to work with them closely on reporting, but also finding out how we can help. It's really important. We want to make sure as a public health department that we're ensuring that anybody who wants access to a vaccine has that. And so we are working with local organizations and identifying, we hope that by putting out that information, that schools that do have lower vaccine rates will reach out to their local healthcare providers, their pharmacies, the health departments in their communities and the state to offer clinics and make sure that this isn't an access problem, right? We want people to have access to these very safe vaccines that really have proven that we can reduce the spread and get rid of measles in our communities when we have community immunity.
Yes, it's Barbara. Let me ask you, why do you think there are so many cases or an unusual number in Lancaster and Lebanon counties? And what do you say to those people who believe there could be negative side effects to the vaccine?
You know, we live in a very complex world of information. And I want to really concentrate on the fact that the vast majority of people in our country have never seen measles. They don't know about its severity. We have lost that knowledge. And so people are appropriately asking questions, right? They don't see the risk to themselves if they've never seen the disease. And we see that as healthcare providers, we forget about it if we don't see it as well, which is why we're doing a lot of education. So I think it's really important that we allow people to ask questions and be inquisitive and find out what they need to know to understand. But we also know that when we see a resurgence of an infection like measles, people appropriately come in and get vaccinated because they see it as a real risk. It's hard when it's imaginary, right? If you don't see something and you say, oh, this is, theoretically a risk, but people are seeing it now and they're coming in, right? We've done 430 vaccines in small and large clinics across the area. We see this with RSV vaccine. So, the RSV vaccine has been available only the last couple of years. RSV is the reality in any childcare setting, and anybody who's got young children, they know it, they see it, and they recognize it, and they accept those vaccinations. So I think, again, part of this is we're victims of our own success. If you don't see it, you don't see it as an issue. So that's one. And people get information from so many sources now, and it's kind of information overload and confusion for people. And so I think there's lots of reasons why people don't get vaccinated. But I want to say we understand, and when people have the why, right? We all want to know why we do something. We don't just want to do it blindly. So I encourage people to talk to their doctors, ask questions, be curious, and get good information so that you can make an informed decision for you and your family.
Is there a lack of vaccination in Lancaster and Lebanon specifically?
So again, as we've heard from our doctors here, the vaccine, the measles virus goes to unvaccinated communities, and it spreads more quickly in those. So again, we're here to really encourage people to build community immunity here so that we can protect our vulnerable populations.
Do we know what the origin of this outbreak was?
We know we do when we find out about a case of measles, we call folks, we talk to them, we find out where they went, who they might have exposed, and we contact those people to try to contain the virus and spread, and to offer people who've been exposed vaccine and good information so they know how to prevent the spread. Our job, we want to keep people's confidence. We don't ask questions that we don't need to know about. We really focus on the case and the contacts, and that's the focus of the work we do.
Yes. So measles is a reportable disease to the state, but there's obviously people who don't go to the doctor who may have it. Do you have any way of estimating how many people you're not getting numbers for who might have measles?
We do not know. We only know the cases that get reported to us, and that's where we work from. But one of the reasons we're doing this kind of an event is to hopefully to let people know that if they call the department and they let us know they have a case of measles, we're doing it to protect them and their community, and that this is a safe place to call. We don't we keep people's confidences. We don't share information unnecessarily. We're really here to help the individual. So if somebody has measles and they let us know about it, we then reach out to help them protect them and their family and their contacts. And we really hope that you'll spread that message that we are here to help people and to keep their confidence, but help them keep themselves and their families safe.
Someone in the back, black right there.
Residents actually are starting up online campaigns telling people to stay away from the Department of Health and actually not get vaccinated. Do you think any of these efforts are hampering your efforts to contain the measles outbreak? And are you doing anything to actually upgrade your accuracy on your contact tracing?
Again, we are here doing this event to try to get good information out to people. We build trust one patient at a time, right? One contact at a time. And I think for those people who've had contact with the Department of Health, they know that we are here to help them. And that's the message we are out there to give. So we are working very closely with our trusted community partners across the region, and we continue to expand that circle. We have our State Health Center right here in Lancaster County, right here on this major road. People know about us. They come into we have our staff here. They are parts and members of the community. They are trusted members of the community, and we want people to use those contacts, talk to their folks, and come in and let us help you reduce the spread.
All right, we're going to do two more, and then if you guys want to do any follow-ups afterwards, let me know. FMD?
Yes, are there any cases in the Amish or Mennonite community monitoring that, and then any guidance from the federal government?
Sure. Again, the outbreak is among people who are largely unvaccinated. That's who is really spreading, with whom this virus is spreading. People who don't have immunity, either from vaccine or from prior infection.
Yeah, so students are required to get their vaccines before entering school. The state's data shows that over the last 2 years, thousands of students have been allowed into classrooms without the required shots or the exemptions. I know school year is 2 months away, but is the health department and the education department doing anything to address this issue?
Jimmy, we're focusing on measles on this one, so we're going to talk about that.
Okay.
Wrap it up.
Okay. Well, thank you so much again for being here and getting the word out. I'm going to just say it again. The best protection for folks to protect themselves, their family, and their community is to get a vaccine. And we have vaccines available at all of our state health centers. People can get it at pharmacies, their doctor's offices, find out information on where to get them. Thank you so much. Very clear on a few things. First, the Department of Health is working closely with healthcare providers and community partners to prevent the spread of measles and provide easy access to vaccinations.
Typically, the symptoms seem to appear 1 to 2 weeks after exposure. The earliest signs include a high fever, cough, runny nose, and red and watery eyes. These symptoms can easily be mistaken.
And a mother with young children who have, with children who are fully vaccinated, who are fully vaccinated and immunized. I strongly urge anyone who is eligible to get the vaccine